Now, take a look at shares of Nestle, up just about almost 10%. The CEO is saying the company will simplify its organization and automate processes as they cut 16,000 jobs. Automation doesn't necessarily mean AI, but the comments add to the debate over whether the technology will create or destroy jobs. Fed Governor Chris Waller saying this week, quote, AI seems to be moving so fast that we'll see the job losses before we really see the new jobs. And from corporate leaders, well, Jamie Dimon this week saying AI will, quote, eliminate jobs and people should stop sticking their head in the sand. Amazon CEO Andy Jassy writing, in the next few years, we expect that generative AI will reduce our total corporate workforce as we get efficiency gains from using AI extensively across the company. Salesforce has cut 4,000 customer support agents, with CEO Mark Benioff saying the company needs fewer heads. Accenture's CEO noting last month that it's exiting workers who can't be reskilled in AI. And one of the first leaders to sound the alarm was Anthropic's Dario Amodei, who said AI could wipe out half of all entry-level white-collar jobs. Well, joining me now to discuss is Kuldeep Singh Rajput. He's CEO of OutcomesAI, a company that uses AI in front of healthcare visits to enable more patient care time for nurses, less time spent on rudimentary questions. Kuldeep, welcome. Tell me, where does AI play in the mix, depending on the industry and the demand for human labor?
Yeah, John, I actually agree with, most of the CEOs, what they're saying. AI will replace jobs, but the impact really depends on the nature of the work and the pace of adoption. In industries like banking and customer service, a lot of people do transactions, answering questions, processing forms, executing standard workflows. And these are precisely the kind of tasks AI can automate very quickly. But when it comes to manufacturing and logistics, we have seen this story before. Automation changes job mix, but it also creates new technical and supervisory role. And the real challenge there is retaining and reskilling, people at scale. But when you look at healthcare, it's the opposite problem. We don't have too many workers. We have a massive shortage of nurses and physicians. And there's a projected shortage of almost 1 million nurses by 2031. So in healthcare, AI isn't replacing people, it's restoring capacity.
So it seems like a part of the divergence here is whether the industry is about touching stuff and touching people, right? We need somebody to do that, and it's high value to do that, or if it's about thinking about stuff, in which case maybe the thoughts you need to have are higher order, higher level, not plugging stuff into a spreadsheet, but being able to make connections?
Yeah, I mean, it again really depends on the industry. But again, looking at healthcare, healthcare is very personal. People expect more personalized care, and nurses and physicians enjoy doing their job, which is caring for patients. And unfortunately, over the past few years, a lot of their time is being spent on administrative work, repetitive tasks, and because of which, you can't scale capacity. So I think that's a perfect example of where, AI can be utilized. For example, if you can take that 60% of the work nurses are doing, answering, calls from patients, doing care coordination jobs, documenting, data into the EHRs. Those are the kinds of tasks I believe can be taken, by AI and done by AI much more efficiently, while you're giving time back to the nurses and physicians to do what they do well, which is care for patients.
Kuldeep, this seems less similar to me to the Industrial Revolution, where you had people coming off of farms, doing physical work there, into factories, doing physical work there, more similar to the offshoring or outsourcing challenge of, hey, there's another workforce that can do this more efficiently or cheaper, and so you just need to develop a whole new skill set, no?
Yes, I think so. I mean, even if you take, any example, for example, like customer support, or you're taking nursing. Obviously, nurses have to, upskill themselves to use these, AI tools. And especially in healthcare, it's very important to build that trust make sure the AI is safe, and you're reskilling people. So I always think of this as AI plus humans combined together is going to create a new industry.
So soft skills perhaps not so soft anymore in this era of being impacted by AI?
Yeah, I think AI is now getting better at soft skills. When we train our AI at Outcomes AI, we are calling the patients, and the AI is having conversation with the patients. And the number one thing we make sure is the AI is empathetic, has bedside manners like a nurse, and really understands the user and the patient, even if it's not doing core clinical work, but you still need to have that empathy. So obviously you can't replace what nurses can do and what physicians can do, which is really important.